אפילו.
יהודה,
טוב,
תודה.
יש דברים חשובים יותר לעשות.
תודה, אני רק רוצה לעבור בזריזות לראות שיש לנו את כולם. אז אני רואה שרפאל איתנו, ואני רואה שאביטל איתנו, ובנג'מן איתנו.
שלום, שלום לכולם.
היי.
Hi, Benjamin. Nice to meet you.
Very nice to meet you.
I heard so much from Eliran about you.
באמת? איזה יופי.
דורית.
אפשר בעברית, הכל
חברים, סליחה לכולם. אני מבקשת סליחה לכולם. דורית איתנו? לא. פרופסור בנטוויץ'? עדיין לא. מריה?
Yes, good afternoon, everyone.
Hi, Maria. Nice to have you with us. Maureen is with us also. So we're missing Dorit and Professor Bentowich among the panelists.
Okay.
Okay.
Okay, excellent.
Now everyone has time and each one can introduce themselves or discuss anything that is on their minds right now. We still have something like 10 minutes before we proceed.
It will be in English or in Hebrew, all the event?
In the event, it'll be in English.
In English, okay. Perfect.
Yes.
Thank you. Otherwise, I might be a little lost.
You and me both, Maria.
And I asked all of you, with your permission, and I will ask that, I will mute everyone when we start, but I want to make sure that you can open your mics. So let's try it. Just me, I'm trying to unmute all the participants. Let's try.
Manage participants.
That's where I am. I'm looking at the participants.
Manage participants
Shall I
on the
do it,
right on the bottom.
I open the participants.
Do you want me to do it? Since I'm the host?
Yes. Ah, maybe that's why I can't.
You're not the host. Perhaps Bruria, you should be given co-host. Who's hosting the meeting?
Oh, I have no idea how to do it. Sorry.
Hi, Alex. Thank you for joining.
I think Donna and Sid, no?
Try for a minute to host everyone, to mute everyone, and let's see if they can open their mic. Who opened this meeting?
I think Sid.
Sid.
Maria?
Yes.
Yes, I can hear you.
Can you please unmute everyone? And let's see what happens.
Mute everyone.
Here we go. Did it work? Okay. Just a minute.
And yes, we can open our mics after.
Okay.
Okay, so I'll...
And I've opened mine. Fine.
Okay.
Yeah.
And I did mine also.
What I will request from everyone, whenever they're not talking, to mute. Otherwise, there is background feedback, and we won't be able to hear anyone. Is Alon with us already?
Not yet.
Bruria, can I make a suggestion?
Certainly.
The easiest way to unmute yourself, if you just have a short comment to make, is to just hold down on the space bar on your keyboard, and that unmutes you temporarily until you let go. If you have a longer comment, then you can unmute the mic.
I have to leave it, okay? And then when I press it again.
But because you're reversed.
Yeah, thank you. Okay. Okay.
Can we do the introductions, because I don't know most of the people online?
Well, there are now more than I think the panelists, but let's go one by one. Avital, let's start with you. Everyone, please just briefly introduce yourself.
Happily. Hi, I'm Avital Sandler-Leff. I'm the new executive director of JDC Grid, the department in the Joint that helps in humanitarian disasters and developing world.
Thank you. I'm Bruria Adini. I'm from the Tel Aviv University.
Hi, I am Benjamin Laniado, the General Secretary of Cadena. It's an NGO. We do humanitarian and disaster relief also in crisis all over the world.
And where are you sitting physically now?
In Mexico City.
So, Benjamin, can I ask you, it's not president and founder, or would that be correct when I introduce you as such?
It's good also, no problem.
Thank you.
So I'm Alan Rothenberg. I'm a JDC board member and a past chair of this committee.
Hi. Next. Maria, would you like to introduce yourself?
Yes, good afternoon, everyone. My name is Maria Soledad. I'm COVID coordinator for the ICRC, the International Committee of the Red Cross, based in Goma, in Democratic Republic of Congo.
Guy, would you like to introduce yourself?
Yes, hello. My name is Guy Wolf. I'm the VP Marketing and Sales for Galili International Management School in Israel.
Thank you. Gayle, would you like to unmute yourself and introduce yourself?
Hi, my name is Gadi Ben Meir. I'm volunteering Rescue Without Borders. It's a humanitarian organization that we usually go to natural disaster sites and help people. I'm just here because I saw this conversation. I got an invitation for it, so I'm really interested to hear what everyone has to say.
Nice to have you.
Did you say MSF? I couldn't hear.
SSF.
SSF,
Savants
okay.
Sans Frontières in
Just-
French
No,
and
I
Rescue
understand.
Without Borders in English.
I know the difference. Thank you. Okay.
Elhanan,
Hi, I'm Elchanan Baron from the Israel Center for Disaster Medicine and Humanitarian Response at Sheba Medical Center, in charge of setting up the Corona facility in Sheba Medical Center a month ago.
thank you, Elhanan. Meek? No, Meek, you're muted. Good.
Hi, I'm Mick Alkan. I'm an infectious disease physician, and as you can tell from the color of my beard, I am in a high-risk group, and that is why I'm not very active right now.
Thank you, Meek. Maya?
Hi, my name is Maya Savira. I'm the director of Justice Spirulina. We are an NGO working in the field of malnutrition, mainly in Africa.
Thank you. From Sid, Maria, would you like to introduce yourself? And then Dana?
Hi, Maria from Sid Israel. Nice to have you all. Alon will give us some words about Sid Israel later on in 2 minutes.
Yeah, we're just now informal before we start. Dana?
Yeah.
We can't see you, but we see your name. Dana, do you want to unmute yourself? No. Then Shimon Horowitz? Neither. There's someone identified as iPad. No?
Hi. iPad is very personal.
Yeah.
Very specific.
Very much so. Danny Can, would you like to introduce yourself? Just unmute. Unmute the mic. Danny,
So Danny Khan, also a white bird. I am the head of Natan International Humanitarian Aid, and we are dealing with the disaster relief these days, working on the preparation of a quarantine camp in Gaza.
Thank you. Dina, hi. Would you like to introduce yourself?
Yes, sure. Hi. Hello, everyone. Hi, I'm Dana Gidron. I represent the PES Foundation. Good to see you all, hear you all, some very old friends and some new ones. By the way, those who have the wrong name on their picture, iPad, Yardena, etc., it's easy to rename yourself. You just click on the right click on your picture, and one of them comes up as rename, and you can just write in your actual, whatever name you want. Here, I'll do it right now.
Thank you, Dina. And now I see that Dorit is with us. Hi, Dorit. We're still in the pre-conference, in the pre-webinar, and just took the time to
Yes,
introduce.
I'm coming from webinar to webinar. And hello, everybody. Shalom. I am Dorit Nitzan, calling from Copenhagen, where I am the acting regional emergency director for the WHO European region. I'm a pediatrician, public health. That's it. Thanks.
That's a lot. And in these days, even more than ever.
Thank you.
Alon, do you want to informally introduce yourself? We still have 2 minutes before we start formally.
So hi everyone. Yeah, we still have a few more minutes before we start. So Alon from Seed Israel, thank you for joining us. And it seems that we will have a very interesting discussion shortly.
Right. Thank you. Tomer? Tomer Malchi?
Alan, are we in English, Hebrew?
English.
English. So my name is Tomer. I'm the director of Cultivate. We're a development organization focused on agriculture and water, working mostly in Ethiopia. I'll just say that we've had a lot of requests from the area that we work in for support, and I have no idea what we can do to help, but hopefully just by hearing what's going on and being part of this, I'll have a better idea. So that's why I'm here.
Thank you for being with us. Nimrod.
Hi, how are you doing?
Good until now. Hey, Michal, did you for some reason share your screen?
Who did?
Michal, I think it was Michal Brook. You don't need to leave the meeting. Okay. Go ahead, Nimrod. You were starting to introduce yourself.
Hi, nice to meet you all. I'm Nimrod Gerber. I'm managing partner of Vital Capital Fund. We're an impact investment fund working in Sub-Saharan Africa and India. And we work in basically in impactful business that enhance the well-being of underserved communities in Sub-Saharan Africa. So this pandemic and its interface with Africa has a lot to do with us. We're also involved in healthcare services, so we'll be able to hear and learn, and also maybe share what was our and what is our reaction to this situation.
Thank you very much. Alon, we're at the exact time that we planned to start this, and we're very happy to have 75 people with us, and the number is still growing. So would you like to initiate this meeting? And then within, we'll be able to hopefully meet everyone and let everyone be engaged.
Great. All our speakers are with us already?
Except Professor Bentowich, which I haven't seen as yet. But Professor Bentowich
will join us later.
Or he'll see what he can do, because he also has another television engagement. So he'll see if he'll be able to be with us.
Okay, so good evening to all of you. I will start briefly and by saying hello, and thank you for joining us today to discuss the Corona crisis and its effects on the developing world. My name is Alon, and I'm the Director General of the Society of International Development, Seed Israel. If some of you don't know, I will say that we're an umbrella organization of over 150 Israeli civil society organizations, private companies, government agencies, and academic programs that actively work in the field of humanitarian aid and international development. Seed Israel mission is to encourage Israeli involvement in and action in emerging markets through economic, social, and humanitarian work. As an umbrella organization, we felt obliged to take action in the outbreak of the COVID-19 in the developing world and address if and how Israeli and Jewish aid community should act and understand the needs of the developing world in this crisis. In today's webinar, we will hear from great speakers about the current situation in different countries and discuss the future needs and involvement of Jewish and Israeli organizations in aiding and addressing the crisis. As we know from past crises, it is still too soon to understand exactly how tremendous the effect will be on developing countries, but it is already clear that there is a need for solutions that take into account the large cultural and economic gaps. In some places in Africa, for example, where sanitary conditions are poor, there is lack of flowing fresh water, and poverty and hunger are too common. Social distancing or stopping war can be challenging. This gap will require out-of-the-box thinking and vast cooperation that we hope to start thinking about here today. In many ways, the outbreak of the corona around the world has created a paradox. On one hand, countries are working in an emergency mood, pushing social distancing and taking care of problems at home. While on the other hand, all understand that this crisis has hit all the world and require great global cooperation to overcome. As an organization that promotes cross-sectoral collaboration, we see the importance of working together at cross-border level. We hope that this webinar will clarify that to truly manage and overcome this crisis, especially when working in the developing world, joint efforts between governments and organizations are critical. I'm taking this opportunity also to update you that in the next few days, we will share a survey with over 5,000 local NGOs from low-income countries in order to get a better understanding how their work has been affected and how the outbreak of the coronavirus affected their communities. And we will invite all of you to share it with your partners on the ground. And now, allow me to invite back again Dr. Bruria Adini, which is our very close partner, the head of the Department of Emergency Management and Disaster Medicine at the Tel Aviv University, to take the floor and to start our discussion this evening. Bruria, please.
Thank you very much, Alon, for the introduction and for the opportunity to actually be all of us together. And what we want to do, this is an opportunity to brainstorm together how we can collectively facilitate the work across this country. If I may ask everyone and Maria to mute everyone when one of us is speaking. Mute? Okay, I hope now we'll have lesser feedback in the background. What we want to do is brainstorm together how we may collectively facilitate the work that is done by numerous bodies in low and in low middle income countries in these challenging times, as Alon have said, of the COVID-19 crisis. I think that the lessons that the international community at large and each nation specifically, all of us are learning today is how appropriate are the values that characterize the humanitarian space. The coronavirus reminds us, all of us, that we're all equal, regardless of our culture, of our religion, of our financial situations, or even how famous we are. We now have royal members, we have prime ministers, we have well-renowned actors, as well as homeless, refugees, and many others that have contracted the virus. So hopefully, in the same way that the virus completely disregards the geographic border, so will we. And what we want to do is together try to set another border, and that is the border between humanity and the viruses rather than between people. We have, as Alon said, several goals in our present webinar. In contrast to the webinars that SID with all the partners initiate every week, which aim to depart knowledge, here we want something different. We want to share insights concerning the way that all of us may assist the civil society, both the national and the international bodies, to be effectively involved in responding to the needs of those low and low mid-income countries in managing and hopefully in containing the COVID-19, while continuing simultaneously to be able to provide essential services such as food, clean water, shelter, medical care, education, and all the other vital services. We're mostly interested in this specific meeting, and this is the first meeting, a preliminary meeting to what we'd like to do. We want to hear the practices, the insights, as well as the recommendation that may be generalized to diverse entity. It's important that all of you, and I'm very happy that we have one more and we'll have 100 participants with us. We want all of you to be actively involved and engaged in this webinar. Share with us your practices and your perceived constraints of the work that you do in those countries in which you operate. Raise the gaps that exist and any recommendations for action that may enhance the collective capacity to work alongside those governance bodies, the local civil society organizations that are placed in the different countries in order to combat the pandemic and allow the society to bounce forward. So we have among the participants 8 panelists, and I would like to very briefly introduce the 8 of them. The first is Dr. Dorit Nitzan. She's the acting regional emergency director of the WHO in the European region. We have Avital Sandler-Luff, which is the executive director of the International Development and Disaster Response, the JDC grid. I hope we have Professor Tzvi Bentowitz. He may be in and out of this meeting. He's the president of the NALA Foundation and the head of the Negev Center for Emerging Diseases, the Tropical Diseases and AIDS. We have Professor Yuda Newmark, which is the head of the Public Health Department in the Hebrew University, as well as we have Maureen Molowini. She's the head of the IMPH, the Alumni Academic Coordinator in the Brown School of the Public Health and Community Medicine in the Hebrew University. We have Maria Soldat Reda from the ICRC, the International Committee of the Red Cross, that is now placed in the Democratic Republic of Congo, but she was in very many countries before. And Rafael Marcus, which is the Senior Vice President, the programs at Hayas. And our last panelist is Mr. Benjamin Laniado, the president and the founder of Cadena, which is stationed in Mexico. Now, you saw that even introducing, just a brief introduction of the panelists took us time. So because we want both the panelists and the attendees to be able to briefly present the work of their organizations, what they're conducting, what operations they have in the low and the low middle income countries, and how the needs and capacities of the local administrations have changed as a result of COVID, and how the activities of the different aid organizations or the civil societies have been impacted, it'll take time. So we have 2 hours at our disposal, but we want to make sure that we actually make the most of it. So what we're going to do, instead of giving all the panelists one by one the opportunity to present the work, their recommendations, and so on, what we will do is that each time 2 panelists will very briefly introduce their work and their thoughts and recommendations. We will then open it for varied questions. Both the panelists can ask questions, all the attendees can ask questions, and so on. And then we will go to the presentations of another pair. You can address the question to any panelist or actually any of the attendees. Any question may be answered by all of us, because this is what we want to do. We want to share the insights, the thoughts, the recommendations. So I would like to start with the first pair of panelists. The first one will be Dorit from the WHO, followed by Avital from the JDC. So Dorit, the floor is yours.
Thank you very much, Bruria, and hello, everybody. Very excited to be with you all. Yes, so WHO has been working around the clock with our member states and with the regions and areas that the contested areas as well. We are trying to work at different levels, really running, I would say, after the virus. The virus is about 13 weeks old within us. I mean, it was introduced to us as humanity 13 weeks ago, and we are really learning a lot as we go, but we need to move fast. What we do, we develop standards and the guidance documents. And as those of you who are exposed to the clinical work could see that it is changing and evolving as we go. We try to capture what can be done in order to control it. Initially, we called it containment, then came the words mitigation. Now we are saying the blended approach, and we are tailoring now for each of the countries and each of the context and the scenarios. We are tailoring the intervention that need to be taken. The issue is that many of our countries are countries that are not fortunate enough to be able to prepare in advance or to respond according to these guidance documents. And for this, we are there also on the ground with you guys, with lots of NGOs and our operational partners on the ground. We work to implement and to ensure side by side with the authorities that things are being done. We established laboratories that can diagnose, including in Africa. In Europe, we have now 5 reference or referral laboratories, we call them, that countries that don't have lab capacities can send it there. And we trained staff, we developed the reagents and all the system to diagnose the disease. And it's very important to understand that we know how to do it now. We learned a lot from China and the neighboring countries to China, but we are now in Europe. We are at the epicenter. I think that yesterday the United States joined us in numbers, but we are really hit badly in Europe, and we are watching what's going on in Africa and in other parts of the world, and already preparing ourselves to support them. What we will see in Africa, that we also see in parts of Europe, in the Central Asian republics, some of the Balkans, etc., we see that the conditions we have to do something to help the communities. We have to work with the communities, because we say isolation, we say quarantine, we say wash, and hygiene. We tell people how to behave. And in some circumstances, we have to understand that it's not going to be easy. For this, we will need to find solutions. We need to make quarantine a very good place and healthy living place. We have to isolate those who are sick, even if they are not tested positive, because there are not enough tests. And we see this in many countries now. And how to work. And that's the other thing that we see now, which is huge challenge for us. The borders of many countries are closed. Our things, all our oxygen and pulsimeters and reagents and PPEs are stuck. Some of them are stuck in Istanbul, some of them are stuck in Copenhagen and in other countries, and we cannot get them anywhere. Now we signed a contract with the World Food Program, and they will fly it for us. But hopefully some countries would allow them to arrive to the countries. Our teams of experts, of doctors, nurses, emergency medical teams are stuck. Sometimes they are outside the border, they cannot get in. We are now working globally to get us inside, and it is helping a bit. But it's very hard. When you come back from such a country, you have to be 2 weeks in quarantine in many of the countries, especially in our countries here in Denmark. So we also have to take this into account. it's very complicated, but what Bruria, what you said was very touching and very true. We see that this small virus can make miracles if we do learn to work together and to give the right answers for people in the right settings. So I don't know if it was enough, but thank you very much. Over to you.
Thank you very much, Dorit. You gave us an overview of the challenges and the complexity that this situation has actually put in face of us. And I have no doubt that many of these challenges are even worsened or more complex in the humanitarian space, which we are addressing in the low and mid income countries. So maybe we'll also touch on that. I would like now to invite Avital from the JDC grid, if you can give us some of your feedback, some of your insights from the work that you're doing. You're still muted.
Okay, can you hear me now?
Yes, very well.
Great. So hi, everyone. It's a pleasure being with you. I'm excited, first of all, for opportunity to get dressed in these days. It's not obvious, as you all know. And it's and I'm very impressed. Thank you for SEED and for Tel Aviv University for this impressive panel. I see that we have many participants, and thank you for this opportunity. So JDC is responsible to react to humanitarian disasters in the last 40 years, and we've been doing so. And we look at this pandemic as a humanitarian disaster. This is why we continue to act. I will not speak on behalf of my Israeli colleagues and and of course our colleagues from the former FSU. And in Europe, in the 70 countries we work at, where we are looking at our Jewish communities. Our region is responsible for acting on behalf of developing countries, and this is what we're trying to do in these days. We partner with, we work a lot in Ethiopia, as many of you know. And we started there. We launched a WASH program with our beloved partner Nala. I think Michal is here, and maybe Professor Bentwich will speak later on. And we see, as you all know, hygiene and WASH practices are very common. Every day we listen at the news and being told how to wash our hands and etc. And of course, it's so relevant in the countries we work at, where at least in Ethiopia, 41% of people don't have any water in their homes, and others don't have sanitary equipment. So we started with this. In India, we work with our partners, also beloved partner SEWA, who have established a cooperative of 10,000 women, and we work with them for many years. And now, as many of you probably have read, those women and many others are dependent on the daily wages, and during the quarantine, they literally don't have anything to eat. And we were very impressed by their initiative of livelihood, where they started immediately producing masks and hand sanitizers. And we're trying to support them in this. We call it Imagine More, and it's and we also wanted to take this equipment and bring it to Ethiopia, but unfortunately the India government doesn't let the NGOs export this equipment, and we can understand that the local needs are really severe. We also want to diverse some of our funding in the countries we're currently still working on following previous disasters, such as like in Mozambique, and we'll probably launch diverse some of our funds and work to address the needs of the population there. Again, using WASH practices and encouraging livelihood. This is what we did and will continue to do. I want to raise the issue of, and in addition, we've convened the Jewish Coalition for Disaster Relief and Rafael is part of this coalition. We've met already twice, and the coalition is very committed. The partners in this coalition are a very big Jewish organization around the world, and they're all committed to this issue, but we also face the challenge of raising funds for these activities while traditional donors who usually support our efforts, not only in JDC, but in other organizations that work in developing countries, are working with their own communities locally right now, and we're finding it very challenging these days. But we feel committed to raise this flag and to put this and to keep this issue on the agenda, because in the end of the day, this is the consequences will be very severe in those countries, as we all know. And at the end of the day, it will get back to us, and this is something we really need to keep on pushing and working on.
Thank you very much, Avital. I want to address a problem that both of you, both Dorit and you, have raised. Dorit talked about the complexity, the challenges of bringing, for example, vital equipment, and you also talked about the need for the personal protective gear. And you've stated, and correctly so, that some governments do not allow their own industries to export these personal protective gear, including Israel. Okay, Israel also issues such regulations for the industries. So I would like to ask both of you, but I'm also opening it to all the other panelists or to anyone else who would like to relate. What do you think, if any, we can do in that regard? Is there anything that can actually be done in this situation when each country is worried about their own potential constraints, and we know that the constraints are even larger or maybe more problematic in the low and low middle income countries?
I think it's really a challenge. We've been working. I'm again on mute. No, it's really a challenge. We've tried to look for equipment from China to bring to Ethiopia, and we found, and the prices are in. It's not only the availability of those of this equipment; it's also the prices are going up ridiculously. I must say. And I think maybe our agenda should also be encouraging the local organizations to produce this equipment, and there we can contribute both to reaching to have this equipment where we need it, and also to support the livelihood of those poor populations that we work in. That we work with. And I think the advantages of working with local organizations and building on the capacity of the local organization can really is really productive in this, and it proves itself to be right in this specifically, especially in these days. So I think this is, at least from in JDC, we're looking at it, and the example that Sewa had presented, we already put them in touch with our colleagues in the former Soviet Union to see if they can launch such initiative. We're looking at it also in Mozambique. I think this can be some small answer to the problem. The other is we should think creatively out of the box. How can we raise significant funds for these developing countries in these challenging days, facing and acknowledging that every country is looking inside and towards the local communities. So those are challenges we face every day, I guess, those of us who work in this arena, but also, but especially in these days. And I want to mention one more thing. I think we should all not forget the most vulnerable population, like people with disabilities, elderly, asylum seekers, refugees, especially in this space.
You're right, and we will address that later on when both Maria talks and Rafael speaks. Dorit, would you like to also refer to this?
Yeah, just to add to what Avital said, as the WHO, we are also seeing a competition between the organizations and the countries. So, you know, if what we are trying to do, we created a solidarity fund and a solidarity, a kind of OSL, operational support and logistics, so that we will have the power of the peoples and get it maybe cheaper, but the high quality. I have to say that, you know, it's not just to order. We just had some cases, and you probably heard about the Netherlands and Switzerland that had to return what they bought from here and there. So what we are trying to do is get it, test it, validate it, and then send it to the countries through, and many times through our partners. And that's one way to do it. The other thing is that we are encouraging governments to repurpose their industry, paper industry and other industry, if they have even small industry, and to go to think out of the box how to develop tools that would be useful. And we are hearing of very interesting things that are being developed and now being tested. And maybe we'll hear of new ways that we can do it yourself type of thing. And beyond the dependency on products from countries. What we do see is that in some countries like China, we agreed, we got an agreement, and now it's open, but need to be verified. And many of the countries are closing borders, looking at their own security, which I cannot, you know, it's easy to say it's not good. We are, as WHO, saying it's not good, but then that's the fact of life. We can keep saying it. And therefore, we need to think out of the box and to let us get inside the country with much as possible. The whole solidarity here. So we have the Solidarity Fund, we have solidarity research and development also, so that we are doing solidarity clinical trials. The vaccines development are done in a solidarity way. So this is the time that all of us should join under one umbrella and make the power of the people and not patches here and there. Thank you.
Thank you, Dorit. And I think you touched two elements which are really important these days. One, you talked about solidarity, and we know from research and from lessons from various types of disasters worldwide that solidarity and community cohesion and the power of the public and the community enhanced always in these types of crisis, and we certainly can and should make the most of it right now. But you made another point, and I would like to invite both Naftali and Benjamin Laniado, because you touched about the element of validation. Now, why am I saying validation? Because Naftali and Benjamin both wrote in the chat about different ventures that are actually being done by different types of organizations and different type of community to develop in the midst of this crisis, different types of equipment. And we heard one example that I can think of from Netherlands, that they got a shipment of something like 600,000 N95 masks from China, which turned out to be not in the right quality. They don't have the right level of filtering and so on. So Naftali and Benjamin, could you relate to these initiatives which you are raising here, and how do you have any recommendation or anything to tell us, to share with us, how you actually do or these initiatives do the quality assurance?
Well, I mean, very briefly, I think that what people in Israel could do is make processes or technologies available so that people in any country in the world can manufacture things by themselves, in a school, in a college, in a hospital, in a lab. You know, people, if we can provide processes and technologies, people will be able to do that by themselves.
Your suggestion is that we prepare something like a cookbook, and then it can be implemented with different types of resources in local communities.
Exactly, or a fishing rod, if you like.
Okay.
And there have been several articles in the New York Times yesterday and today about that.
Thank you. Benjamin, can you share with us your experience concerning that? You also wrote that you're now making a mask.
Yes, actually, thank you very much. Actually, we are producing masks for the nurses and doctors because we in Mexico we have a lack of capabilities in the government. It's not now. It's not only now because the corona. We are just suffering that in this new administration, that we have a lack of medicines and supplies in all the hospitals in all over the country. So now it's more dramatic, more critical. So we made a partnership with the most important company in Mexico that they are doing 3D products. Okay, so we are designing the masks for the people because the problem that we are expecting already, and we are talking that with the government, with the Minister of Health, that the doctors will be all they will be contaminated too, no? With the corona. So they won't be able to bring the service to the people, to the sick people. So it's an urgent, it's very critical situation. So we are taking all this factory and we are recruiting people that have these machines in home or schools or universities, and to start producing that masks for the people that they are giving the services in the hospitals.
Thank you. I would like to relate now to a question that was raised by Gayle that said that in Africa they need to improve access to testing because they have a complexity. There is no social distancing possible. So the alternative would be massive testing to reduce risk of entire populations. And this is a real problem that we will probably see in many of the societies. So I would like now to approach Professor Tzvi Bentowich, if you're here with us.
Yes.
And yeah, thank you. Then I would like to give you right now the floor. Just if you can brief us concerning your work and the challenges that you have seen. Are they similar to what we heard, from example, from Gayle, or other constraints that you have encountered?
Yeah, let me start by by saying that I, as a doctor, I still want to emphasize something that is not often conveyed, and that is that I think we should all bear in mind that we don't know how the epidemic will develop in those developing countries. In other words, the experience that we have is from Europe and Southeast Asia and China, and we don't have an experience in developing countries, and therefore, if one wants to project what will be needed, it is important to keep that in mind. Having said that, I want you just to emphasize that we are very much committed to trying to help Ethiopia in several ways. We are located in several sites in Ethiopia, and Avital mentioned correctly the very important collaboration and support that we get from JDC, which is one site in Addis, but we have at least 3 additional sites in Gondar, in Mekele, in Adwa, which is Tigray. Gondar, of course, is Amhara. And last but not least, in the southern region around Benchmeji. In all those locations, we have started programs that would reinforce what we have been doing for many years, so to speak, regarding wash, hygiene, because as some of you know, we are committed to the eradication or control of neglected tropical disease. And part and parcel of that is, of course, wash and hygiene. So that falls into expertise, I would say, that we have had for many years. And especially since that means behavioral change, which is not a simple thing, definitely in the Ethiopian environment. Furthermore, we are trying to collaborate also with Site Savers, which has been supporting us for a number of years in trachoma. And lastly, with Merck, רבותיי, אתם מוכנים להוריד את הכל רק רגע? I'm sorry, I apologize because I am sitting in the News 13, which I, in a short while, will have to present the case of what I think about corona epidemic for the Israeli public. So if it's noisy, it is not my fault. In any case, I think that what we are trying to really mobilize is financial help, because I think we know what is needed. There is a great need for the background. Whatever the epidemic way and force will turn out, it is very clear that it is extremely important to prepare the population. What I can tell you, an encouraging note, that in all those sites that I mentioned, namely Tigray, Addis, Gondar, and the southern region, the response of the local people and the communities with which we are working are extremely encouraging and very positive. In other words, people are very receptive. They do need and want any help in terms of materials, educational materials, and things that you have dealt upon, which of course is the major concern. And lastly, I would say that we are, I think, hopefully not over-optimistic, but we are actually preparing shipment of materials from Israel, despite the limitation of exporting such material, from agencies that are ready to collaborate. It's too early to say because we still have not shipped it, but hopefully in the next few days, I will be able to tell you that yes, we are indeed succeeding in shipment of some very important, helpful materials.
Thank you very much, Tzvi. You touched about another touchy matter, something that we're all concerned with, the funding. And Moreover, yourself actually posted for all of us in the chat of some opportunities for that, and we will get back to that later. But I want to touch on another element that both Maya and Gayla have related to, and that is the concern of some of the administrations in some countries that do not take some of these measures which we consider crucial, such as social distancing or such as home quarantine and so on, not because they do not think that these are important, but for completely other reasons. For example, Maya said there is lack of trust of the population in the administration, so they don't, for example, they don't believe that they're sharing the information. They may not do what the governing authorities are telling them to do. Or Gela is stating in Kinshasa, they delayed the directive to stay at home because they were afraid of the high risk of social unrest. So I would like to, and these are two very, very important elements that we have to take into consideration if we actually want to enhance the capacity to work along with the populations, the authorities, the civil societies, and the populations. So I would like to approach you, Benjamin. You have a lot of...
let me, Bruria, just let me answer very briefly what you said, what you asked, in a way. Our experience in Ethiopia, I think that we have been saying for a long time that behavioral change depends very much on the leadership and that applies to schools, to communities, to religion. And we are exactly trying to convey the messages that you have been asking about, and we all ask, that these leaders will lead the change, or at least the more acceptance of these directives by the population. And I think we do see, it's too early to say, through these connections, communities, religion, and schools, that we are successful. It remains to be seen how long it will last, but I think that's the way.
Thank you, Tzvi. And I would like to approach you, Benjamin, from Cadena. Have you also encountered such complexities? And do you see that, that maybe the suggestions of Tzvi are sufficient to do so? Or do you have additional advice that you may share with all of us how to overcome some of these challenges? But please unmute your mic.
Okay, thank you. Yes, actually, we have a lot of challenges, everyone. So in our reality in the developing countries, it's the problem that we have a lack, exactly like you said, about the confidence that we have, the trust that we have in the communications or the politics or rules that the government are launching. So in Mexico, let's say, for example, we knew about the corona, like all of you, and the government was very non-active, like very passive. No? So actually, the civil society have an important role to play, because the government have, you know, their own agenda, and I am not criticizing the government. I am actually just putting the things in the table that we know that the problem in a country, a third world country, with a lot of problems around without the corona, like the poverty. We have in Mexico 52 million people that are living, you know, in extreme poverty. You know? So when you said something like this, and you are a government, you don't know what to do. Actually, you don't know what to do, because if you shut down the economics and you shut down the country, so the philosophical point or the dilemma, it's like what is worse, like the corona, or, you know, the shut down the economics, so the people doesn't have food to eat in the table for the kids. No, so actually this is why the civil society and NGOs can do a lot of work, because the politics are in one side, but the effort of the civil society with the private sector inside the country have to, it can be the difference between one scenario and another. And actually, we are taking here in Mexico and in all the countries that we are have operations in Latin America, in South Africa, and for example, we are taking that like in a leadership. We are taking the leadership with some ideas, very good ideas that I will share with in my opportunity. That we are leading the civil society and the private sector to be together and to give the people some tools and some things that they can use to reduce the suffering, to reduce and mitigate the impact of this phenomenon.
Thank you very much, Benjamin. I think all of these ideas are important, and we all strive to implement as much as we can in order to try to overcome many of the challenges. I want to relate, first of all, I'd like to invite you all to participate both through the chat and of course through just you know, raising your hand, and we'll be able to give you the right of speech. And I want to go back now to something that Ormor Yosef posted a few minutes ago concerning the DEVEX, which published an analysis of funding opportunities. And I know that there are some additional such venture and so on. So I would like to approach now Nimrod from the Vital. Right, Nimrod, are you with us?
Yes, I am.
I think you had some ideas which you would like maybe to share with us.
Yes, I do. But if you allow me, I just have to say my personal opinion on the approach and the dilemmas that people touched on before. I think the reality and the gap in the healthcare systems in some of the countries in Africa, the gaps are so huge that trying to apply the exact same discipline that we hardly manage to do in the Western world might lead to the wrong results. I mean, if you look at the healthcare system, they're weak and they are definitely not able to handle widespread the outbreak. You know, in most of the countries, intensive care is almost non-existent. Look at Kenya, which is 50 million people with 130 beds of intensive care. Look at Uganda with 40 million people with 55 beds in total of intensive care. And I'm not talking about the countries with less capacity like Central African Republic, etc. So Kenya and Uganda are advanced. Look at doctors. 1 to 300 in Europe against 1 to 5,000 in these countries. In sub-Saharan Africa, and you know, the hot merchandise of today, ventilators. So you know, the New York governor asked immediately for 30,000 for his 8 million people, and an average country in Africa of 8 million people have today around 3 ventilators. So the gap is so huge that I'm not sure that sending some supplies will make a dent in that, and I think that it might turn if governments will try to apply the same disciplines and, you know, stay-home solution, quarantine and curfew. I think it might be a crisis of civil order first, because as was said here before, people need to eat. And people that live in slums, they go out in the morning to get their food in the evening, and no stay home and no curfew will hold them back. On the other hand, I think that the demographies, they are different. I mean, if you have a large portion of the population as elderly in Europe, you know, I don't know, 1 in 5 or 150 from 750. In Africa, you have from 1.3 billion people, you have very small number of elder people. It's true that you have other diseases and malnutrition that might make this population vulnerable, but I think maybe our role is to advise these governments to take a different discipline and not necessarily to try to force the stay-at-home discipline that we hardly manage to do in our own countries. I don't think it works theoretically, stay at home in these economies. And unfortunately, the video clips that we see in recent days from various parts of Africa, when governments are trying to enforce the stay-at-home discipline, are very, very troubling. So I think this might be maybe a very big contribution of professionals to think of the demographies in Africa and maybe come up with a different kind of discipline solution. This is my own opinion, and I'm by no means a professional on that. I've been living and working in Africa for more than 10 years and involved in these kinds of operations. What we try to intervene in today, and we did it very quick in 2 things. One is to tackle the challenge that was mentioned here earlier by Avital, I think, that sometimes the operational challenge and the funding is what stands between these governments and getting a medical supply. So we intervene there, doing supply operation in terms of loading an airplane and flying it to a country in Africa, and solution for immediate financing, so it won't stand in the way, it won't take too long while a humanitarian disaster might evolve. So this is one initiative that we took. And the second is exactly tackling this gap of economy. And I think Benjamin touched it. It's a huge dilemma because if people don't mobilize, and these informal markets, which is 85% of the market in Africa, is not out in the street and alive, people don't have buffers. They are hungry the day after. So we are funding exactly these small and medium enterprises in Africa in order to keep them alive and producing the impact. We usually build companies and that create positive social impact, but this time we changed our model a bit in order to save and rescue these existing local companies that produce food and water and healthcare, etc. So this is our intervention.
Nimrod, thank you very much, and I think your input was very important, and this is a dilemma that all of us are trying to discuss, both within each organization and between organizations, even in the international community. What measures that we are seeing in different countries may actually be adapted? None can be adopted as is, but maybe adapted to other countries with other religions and types of governance systems, and a relationship between the population and the different governing bodies and so on. I would like to approach Yotam from Israel. You have been, as an organization, working in many countries, and I would like to hear your input of what you have actually learned and what you can share with us, insights concerning what works, what doesn't work, and how your experience led you to insights which actually may be generalizable to many other organizations.
I think, hi everyone, thank you, Bruria. I think for us, first of all, we're really early still in the game, but both from our experience during the Ebola outbreak and in general, we can't really send staff, we can't really send doctors, we can't sending supplies. I totally agree with Nimrod. We did it in the beginning in China, but now when it's all over the world, we found it kind of counterproductive. We really believe that community-based initiatives, especially in developing countries in sub-Saharan Africa, are the key. And we know that at this stage already, it's almost in every country of the globe. So it's not about prevention, but it's more about containment of the virus. And actually, there's a lot of really good work that was done during the Ebola outbreak. I was personally about 9 months in Sierra Leone. There was no vaccine, there was no protective equipment, but it was stopped. And it was stopped mainly because of a lot of great education and hygiene promotion and community-led initiatives around quarantine, around using all the platforms that you can think of, from SMS to WhatsApp to radio to community theater to anything that's possible. Obviously, it's challenging without being able to gather on the street, but these community-led initiatives are important. I also see on the chat that hand washing is not a solution. I don't think I completely agree. I mean, we've seen from our experience in Kakuma refugee camp in Kenya, we're now installing a lot of hand washing stations. I know some of our staff from there are actually on this call. Maybe they can share also their experience. People, when they understand, when they get enough information, when they get it in a culturally sensitive way, in their language, in their culture, in a platform that they're using from their leaders that are not usually the politician, it could be religious leaders, it could be community leaders, they actually follow the regulations and the rules, and they are the best people to actually stop the virus. So for us, in being in 13 countries and having about 250 local staff altogether, we believe it's the key to the success of our programs.
Thank you very much, Yotam. And I would like to continue what you have started and actually approach Mick Mick, you also wrote that in many places, and I think also Dorit, it was Maya, that also said people cannot stay in. People cannot do everything that we think that this could be natural because they need to go out there and find food and so on, that the bare necessities and so on. So would you like to share with us your insight? You also have a lot of experience. You're working in many different countries. What do you think would be practical, and that would be something that may help other organizations to be to facilitate more this combat against the virus?
Well, it is a horrendous problem because, number one, these countries are not spending money on their healthcare on regular days, let alone in emergencies. They have no way of treating everybody like we do in Western countries, at least attempting to have a respirator for whoever needs it. So the bottom line is the healthcare system cannot be relied upon to curb this epidemic. Number two, trust of the government is critical. And I would say there is a vast difference between the Democratic Republic of Congo and Ethiopia, particularly northern Ethiopia, in the trust that the citizen has regarding government instructions or orders. Next is the issue of food. People will starve if they are not allowed to go out and do their daily struggle to get enough food to get through the day with the family. So there will be hunger. And the last issue I want to make is, how do we address the day after? And I think that none of the participants in this panel has addressed the issue of the day after. How do we get out of this? What will happen in different countries? Will they be similar to what they were before the epidemic? And my reference to this is Saramago's book on blindness, the last chapter, when the epidemic stops and gives an opportunity for a happy end.
Thank you, Mick. Well, you stopped at a happy end. That's something that we all pray for and hope for. I want to take this conversation to another direction. And actually, Galit talked about social distances in slums, in refugee camps. And I want to take the conversation to those vulnerable populations. And we have with us two panelists, one Maria from the ICRC, and the second is Rafael from HIAS, both working with such vulnerable populations. So I would like to invite you two, first you Maria and then you Rafael, to actually share with us your insights, your experiences, and how the complexity becomes even more complex when we're talking about such populations. So Maria, please.
Thank you very much. First, for the invitation to sit at Tel Aviv University, and to all the participants. I'm extremely happy to have this discussion, and it's also extremely encouraging, especially that from so many angles of the world we're coming together to talk to something that is pertaining to all of us, and is preserving our shared humanity above all. So thank you very much. So as you mentioned, I work with the International Committee of the Red Cross, the ICRC. I'm based in Goma, in Democratic Republic of Congo. And my words come first from my heart, because for the last 15 years, I've been working in many places, in Somalia, Ethiopia, Central African Republic, Liberia, also, places that have been stricken by conflict, by protracted armed conflict, and where populations suffer constantly. So my insights come precisely from the interactions with communities. And here, I would like to start joining the message that Benjamin Benjamin started, talking about communities and how important it is to work with them from the offset. Certainly, we'll have struggles in terms of logistics, in terms of technical equipment, in terms of personnel. Those elements, perhaps we'll try to work on it, and perhaps we'll reach them. But if we don't work with communities from the beginning, we're condemned to failure. Because in the countries that I mentioned, oftentimes the structures are very weak and very fragile, precisely because of the consequences of conflict. So working with communities is fundamental. Now, the International Committee of the Red Cross bases its work on the large network of Red Cross and Red Crescent volunteers, and of course, Dagen Abid Dadom in Israel as well. And precisely with this experience of volunteers working with the communities, being part of the communities, we're all able to reach to the most remote places. Internationally, we have millions of volunteers engaged. Now, specifically for the ICRC, we work in more than 80 countries around the globe, and these are conflict places where there's conflict and where there's violence. And in these places, the most vulnerable being the displaced population, the detainee population, those affected by conflict would be the ones that would suffer the most. If I can tell you one personal experience, when I arrived in Congo, I went for the first time to an Ebola treatment center to visit one patient. He was standing from the other side of the fence because we had to keep distance with the patient. And while he was smiling, we could see his terrifying fear in his eyes because he didn't know whether he would survive or not. And he was the only caregiver for a family with 10 kids. These are the realities of the countries where we operate when we work. And for us as ICRC in these theaters of conflict and violence, it's a call to the international community. We understand every country has taken measures to protect their own population. But if we don't protect the most vulnerable ones, the virus will continue to spread and it might bounce back. So it's also a moral responsibility and a collective responsibility to continue supporting. To give you a very concrete example, and something that we're working around the clock, day and night, we're setting up the preventive measures in detention centers, in prisons and places of detention, so that the basic hygiene measures can be put in place. In most of the developing countries, these places face extreme overcrowding situations. Prisoners might not have access to water and food on a regular basis, and they live in a very, very crowding conditions. So one single case in a place with a 700 overcrowding %, it will be simply catastrophic. So we're working with our teams around the clock to make sure that all the measures are in place. The ICRC has also various teams, surgical teams working with war-wounded victims, and oftentimes treating them, evacuating them, and making the transfer is extremely difficult. So we're working hand in hand with the Ministry of Health, with the authorities responsible, so that we can put measures in all the facilities that we support. Lastly, and of course, I will leave the space for questions. It's a call also to join the first intervention, preserving the humanitarian space. In these times where absolutely everyone from different angles is affected by the virus, being from a private point of view, from a work point of view, working from home, taking care of your kid while you're working at the same time, all these conditions. And at the same time, we have humanitarian workers in the most difficult places trying to bring help to the populations in need. To be able to do it, we need the support of everyone, authorities at all levels, being at the customs, at the border control, and at all possible levels to facilitate the work of humanitarians. And also, when it comes to humanitarian space, preserving the position of medical personnel, of medical facilities, of medical infrastructures is fundamental. The ICRC is very committed to what we call healthcare in danger, because in times of conflict, in times of violence, and in times of distress, as we are living nowadays, medical facilities, personnel, and structures can be affected. If there is no nurse and doctor to treat the patient, there is no way out. So we also call to preserve the space of humanitarians and the healthcare in general. Thank you very much.
Thank you very much, Maria. I think you very well reminded us all. You know, we're all talking about the big numbers of the affected populations, the morbidity, the mortality in so many places. And sometimes when you relate to one specific story, such as you did with the father of 10 and so on, and we all are reminded once again that the high stakes that we're all dealing with. I would like to ask you, Rafael, now to continue from where actually Maria left, but I want to interject one more question which Galit raised, and her question was, is it actually possible to limit the entrance to refugee camps in order to try to, contain the coronavirus and limit the risk of the spread? You need to unmute.
Yes, thanks, Bruria. And thank you, Sid, for bringing up this initiative. It's great to be here and to see some familiar faces again. Look, I will answer the specific question very shortly, but then I really want to go into some more details. Unfortunately, refugee camps are already limited when it comes to the entrance and going out, and that is not a good thing. And we are actually advocating for the discongestion of the refugee camp in Lesbos, because having them all in those living conditions is actually a big health hazard. So I would not advocate for closing refugee camps even more than they are right now. But yes, so social distancing is really a problem in some of those places, especially for vulnerable people, especially for refugees. Most of them living in conditions which are densely populated, water, sanitation, and hygiene facilities are scarce, and other services are scarce and do not exist. And that poses a problem because they're not really able to access those services. And we really have to advocate also for having refugees included in the national health plans. We have examples of countries which have great health plans on how to cope with COVID-19, but the word refugee does not come up even once, and they're totally disregarded. And that's an important piece for us to be aware of. If we talk about how much refugees are able to do social distancing, so one problem really is that they rely on a lot of services, and those services need to be accessed. And that's why we work in 16 countries. We continue to work in those 16 countries, and we have one goal, which is to keep our staff and our clients as safe as possible while we continue to provide essential services. And it's important just to find out how to adapt and how to find out the new modalities which enable us to really work under these limitations and these constraints. And there are great ways how to do it. And disruptions do bring up innovations, and I think we found some great ways, and I'm happy to provide some of those examples. But an important piece that I would like to add is that while we are seeing that vulnerable populations and such as refugees have additional challenges of how to do social distancing or how to protect themselves from COVID-19, even more, they are adversely affected by COVID-19. Vulnerable populations such as women and girls are adversely affected by COVID-19 by the fact that the vast majority of the healthcare force is women. A lot of women take care of the sick and of the elderly. What about intimate partner violence and now being in quarantine? How do you go? So there's really a need to look at how COVID-19 even exacerbate some of those needs that people have. Most of the refugees that do work in the informal sector, meaning they have lost their jobs. We have reports out of Aruba, for example, that 90% of refugees have lost their jobs within the last 2 weeks. So it's not really only how does COVID-19 affect them directly, but how does it affect them indirectly? And that's an important piece to be aware of. So as I said, we are continuing to work, and our main efforts in the last couple of weeks has really been how can we adapt our programs? So how can we continue to do our programs within the constraints that we currently have? And so this means, so for example, in Panama, our social media platforms are the ones that are now giving out mental health and psychosocial support. Gender-based violence consultation is being done through WhatsApp in bigger groups. We work with supermarkets in Ecuador in order for refugees to be able to access food without us having to give the food out. We have done other adaptations. So food distributions in Chad, for example, are done in smaller groups, but they are done over a longer time. So it's for 1 month, so they don't have to gather as much. And then we have pro bono lawyers doing remote legal assistance to some of our clients in detention center. And I'm happy that this was also mentioned. How do you do social distancing in detention center? It's not possible. So these are just some of the adaptations that we have done that are really working very well. For that, what we had to do is really bring in remote tools. So we have tools for remote protection monitoring. We have tools for remote protection risks assessment, so we can really find out things about the community. What do they need, and ways of really monitoring those needs from remote. And what was mentioned also earlier, and which I very much agree, what is necessary for that is to have this great connection with the community. And that's, I think, where a lot of NGOs come in, because we do have this connection to the community. So we are the ones who are using our platform and our communication channel to actually communicate risks, to communicate about COVID-19 in all the different languages necessary, right? A lot of times, countries totally disregard the fact that they have refugees or asylum seekers within their boundaries that do not speak the local language. And there is a need to have all the information about social distancing, about hygiene practices, about health facilities that are still open, also disseminated in different languages. So you see that the efforts are vast, but I think NGOs such as HIAS really bring the advantage that we do have the open channel to the community. So we are able to do remote work, and we are doing that over various platforms, but we also do have the option to go in and continue to work with them under certain constraints. We have clients, for example, one of the hardest hit areas in the US, and there are some essential services that can just not be stopped. So how do you do that? So you do not do them during rush hour. You do them at different times, so you really limit the amount of people in one place. And you work with the protection, personal protection equipment, which was mentioned here before. So we are just about to, the first shipment already arrived in some of our countries, and we are working with getting more of those shipments in order for us to really continue the essential services. Whatever can be done from remote is being done remote. And as I said, it brings up a lot of new modalities of how to do that. But it's definitely a challenge.
Julieta, did you, thank you very much, Rafael. And I think you raised several very important dilemmas and also some solutions which you're doing. And I have to say that I don't know if it's luck, I'm sure it's a lot of work, but it's wonderful to hear that you were able to manage to procure those personal protective gear and send it along with with the teams that you deploy. Which brings me to another question which I want to raise, but Julieta, did you want to ask something before or comment or something that was said? Just unmute your mic. No, I think you froze. Okay. I want to raise a question, which is actually a continuation of varied elements which Rafael touched upon. Rafael said that the needs that we're now seeing are not only as a result of COVID-19, but there are also a lot of services which we needed to do before, and now it's even more complex to implement and to make sure that we provide them. But at the same time, in this crisis, as it's a global crisis, all of us are engaged in the crisis themselves, not only as providers, but also as individuals. And I want to ask, and this is something that I'm opening here to any of either the panelists or the attendees, anyone that has deployed and activated operational teams in the different countries. Do you foresee, or did you already had to deal with personnel that maybe are unwilling or wary of going out to be deployed right now because they're also putting themselves under risks? So is this something that you have witnessed, and what are the different elements that we can do in order to actually overcome it, including what Rafael, you said, remote work and so on? Anyone like to relate to that?
I can say something. Yes, thank you. I must say that we did not hear of this, but we are faced with a huge number of health workers that are sick, not only physicians and nurses, also cleaners and people that are in the health care arena. So they are sick, or their families are sick, and they need to stay home. And in some places, they don't respect if they are lightly sick, they want them to go to work. And that creates kind of, and we see that. We also see another side of things, which is, I think, I was so shocked to see that healthcare workers are stigmatized and people are running away from them because they are the one who might bring the disease to everybody. And that we see not in Europe, but in other countries, and my colleagues are reporting, and it's scary. So those people they cannot go on buses. They are asked not to stay in the queues. Everybody wants to get away from them. So thank you.
Yeah, Bruria, look,
go ahead.
We work with national, all our staff are national in all their countries, so they do have to adhere obviously to the national health regulations. So this is the big limitation that we have and which we adhere to. Within that, obviously, we are very much concerned about that. We have over 300 staff in Venezuela, a country which maybe has below 100 intensive care unit beds right now. So these are the challenges that we have. So we did put a lot of efforts within the first 2 weeks when we started the response really over a month ago into having guidelines for client-facing staff. So we do have the clear guidelines of how staff that do have to face clients, how do they have to act, what are some of the mitigation factors that they have to take into account. And those guidance notes are also really going down, trickle down into the 4 signature approach areas that we work in. So for HICE, for example, it's legal protection, gender-based violence prevention and response, mental health and psychosocial support, and economic inclusion. But what's really important is to prioritize what is necessary and what is not necessary. And as I said, what is not necessary and what can be done remotely is done remotely. So we went through a big process of having a business continuity plan to see what are the processes that we have to put in place. And we had to have a lot of IT support. Our IT support was great during those times. Really, a lot has been done to get 1,000 people worldwide to work from remote, wherever they can work from remote and wherever they can continue to serve the population. And I would say we did not have a lot of backlash from staff. Actually, the problem is more the opposite. I think for us at headquarters, the problem was to really make sure that staff is not over-motivated and to make sure that they do not continue the work wherever it is not safe to do so and wherever they do not yet have the equipment that they need. So that's a problem we often face in the humanitarian world. We have to keep our staff from being over-motivated and from going into danger. So a lot of work has been done in sensitizing our staff and making sure that they know the danger and they know the concern. I also want to add that an additional important piece that HICE has put in place is mental health counseling for all our staff. So all our staff is able worldwide to access mental health counseling from remote. Obviously this is hard on all of us, also on a personal level. So it's not only about our work, it is also about 1,000 staff starting to work from home. A lot of them haven't done that before, and they have their kids at home. So it's a huge challenge also in terms of staff safety. As Dorit has said, it's really important to make clear that people who do feel symptoms do not come, and the same is also for our beneficiaries and clients. But again, the guidance notes are there, and they are the ones who are guiding us on how to go through that. And the way we spoke about communities and populations having to be able to trust their national agencies and health agencies, the same is true when it comes to an organization. So as long as the staff does trust the leadership and does trust the fact that we have those operational pieces in place, I think it's fine, and you can really overcome those challenges. It would be bad if not, but I think we've done a lot of jobs, a lot of work now in the last couple of weeks to really make sure that we can ensure the continuation of those activities while keeping our staff and clients safe, and that's very important to note.
Thank you. And you mentioned something that Dorit also referred to in her opening words when you talked about solidarity and the need for the trust. And I want to now take the conversation to another direction which we haven't touched as now, which is actually solidarity between different sectors altogether, between the academia and the field. And I would like to invite both Yehuda and Maureen from the Hebrew University. Can you share with us your input on how the academia can facilitate the work, how your graduates are actually working in the field, and how do you continue to support them even after they finish the regular curriculum and they're part of the infrastructure in those local communities?
So thank you, Bruria. I'll begin and then I'll pass the mic over to Maureen. Good evening, everyone. I'm glad to be here on this conversation. And from an academic point of view, we're a little bit off on the side of most of the participants here. And the role of schools of public health, of academic institutions, is to cultivate interdisciplinary training, to develop and to maintain the cadres of public health professionals and experts. And I'm going to allow Maureen to address how we maintain our public health professionals that have graduated from our school, as well as engaging in research. In the best of times, research is challenging. Under the current conditions, even more so. We can circumvent ethical clearance for any of the research projects we want to undertake, as important as they may be. And at our school, the Braun School of Public Health at Hebrew University in Hadassah, after the initial shock, and I think that many countries are still in that initial phase in which it's almost impossible to think about ramping up research. But we're at the point where we've already initiated a number of research projects that have implications not only for the current pandemic, but looking future. Some of you have addressed the experiences that we learned from Ebola. Well, we're going to have many more experiences from this pandemic looking forward. So some of that research involves genetic analysis of the actual virus, predictive modeling based on epidemiological data that's available, mapping the responses of the health systems in Israel and around the world, economic analysis of different alternative strategies for containing the outbreak. We just literally just began an hour ago. We put into the field a survey of foreign healthcare workers in Israel. There are about 70,000 healthcare workers in Israel taking care of the most vulnerable population, the elderly and the sick. And we're doing a survey now on their mental well-being, their psychosocial support, stress, and so on. We're doing surveys amongst healthcare workers looking at burnout and how we might develop prevention of burnout, and smoking initiatives or smoking cessation initiatives because of the increased risk of being infected and developing severe illness and also mortality due to this virus among smokers. This might be a good opportunity to engage people who are smokers to quit smoking, but we have to do this very carefully when people are concerned about all kinds of other things. So one is research. Far be it from me to set the agenda for countries, other countries, and what research they need to do. In low-income countries that are under-resourced, there are some wonderful and strong and experienced research institutes that we collaborate with and that we don't collaborate with, and they'll get on board. They'll ramp up to initiate their own research. I must say one of the other roles of the academia is to play as an objective watchdog for governmental policies. We are very concerned about some of the initiatives and some of the directives that our government has put into play, and we're openly critical when we need to be and very supportive overall. And we've been clamoring for data, data, and data. The only way that we can get a handle on this and to develop evidence-based policies is if we can get access. Some of the data is available, we need access to it, and some of the data has just not been collected. Nobody has kits, testing kits, to spare to undertake some of the very vital research that needs to be done, such as finding out how long it takes from a person's infection till they become infective, and how long do they remain infective. We would need to test hundreds, if not thousands of people over a period of several weeks, testing on a regular daily basis. Perhaps the resources aren't there yet to be able to undertake that kind of research. Very quickly, I also want to make reference to the role of academicians in engaging with the public. One of our professors, Professor Paltiel, gave a wonderful webinar the other evening on making the epidemiological terminology that the public is hearing in the press and reading, which they may not understand, and suddenly everybody is expected to understand what incidence is and prevalence and case fatality and all these terminologies. So we as academicians, I think, have a role of getting out there and engaging with the public so that they understand what they're hearing. Sometimes some of the governments are using fear to be able to implement certain strategies, and it's our goal to translate those messages into ways that people can understand. And finally, and to sift through all the material, the thousands of reports and articles that are being published and come across our desks every day, much disinformation, much misinformation, many errors are being publicized, and it's our job as well. So we have students who are sifting through these reports, trying to get a handle on reliable data and reliable information and get that out there. And finally, I think as Mick mentioned, there will be the post-corona era. We will step away from this. And we have to make sure that we as academic institutions and researchers Don't get bogged down in the current situation. We have a job to do in the long run as well, and that is to continue doing research and continue doing training for the post-era as well. People are dying from other diseases. 45,000 people die every year in Israel, and people continue to die, and we have to do what we can to prevent those deaths and prevent the risk from other illnesses as well, and that has to continue. How do we do that when governments aren't functioning up to speed, so funding is not available? IRB committees, some of the members are in quarantine, ill, cannot access, so challenging, perhaps not as challenging maybe as eight agencies on the ground, but certainly challenging in our work, and we try to do what we can. And I'd like at this point to invite Maureen to share about our graduates from our International Master of Public Health program and what they're doing and what we're doing with them.
Thank you, Yuda. Maureen, can you
Yes,
fill it in?
short and sweet, I think. We have graduated over 40 years, over 900 public health professionals in over 100 countries. And together with our communications coordinator, Ruth, who's on this call as well, in this meeting as well, we've set up WhatsApp region. Our goal has been to facilitate their sharing of experiences and knowledge. In the beginning of this, of when the COVID begins to come into cases in West Africa, particularly was first, 1 or 2 cases here or there. Our alumni were very active in terms of discussing what policy should be, what protocol should be set up, and others said, one wrote that I've been asked or been tasked to write the protocols and guidelines for Burundi. Can anybody help? Does anybody share? And they did. So what we've done then is merge or bring into one group those who are working in and working on COVID-19 to help them share with each other their experiences and information and challenges. They're in very different stages from country to country. And in terms of the Goma, the DRC is certainly in a very, very difficult situation, not as difficult as Uganda, more difficult than Uganda for sure, more difficult than Kenya. But we're following and we're just making those connections possible. We also bring in when we see other studies that our graduates may not have seen, we will post those to say, okay, here's what's going on in France, or here's the study on this treatment or that treatment or what have you. On the community side, which is really where most of you work, in that very, very challenging and also very rewarding community level of work. Some of our graduates our alumni are also working at that level. So we saw yesterday a video from Lagos, a city of 14 million people in Nigeria, with a stadium that has been dedicated for infection control in hospitals, but also food provision. So here's very interesting strategies to put together the clinical side, the preventive side, and the community support. We're hearing from others today from Kampala that the decision to stop all transport on the streets has actually created a very interesting climate change, that the city is cold in the middle of the day rather than being warm as it has been before. And there are environmentalists in Uganda on the technical task force who are monitoring that. So I see our job and we see our job as to promote research, but just facilitate networking and really good evidence-based evidence-based practice for good public health professionals. And as Yehuda said, we're very concerned with what is not taking place in many countries of the world as they face COVID-19. What's not going on in the health systems now? We had during Ebola, one of our alumni who was here at the time went back to Sierra Leone, and then realized that immunizations for kids hadn't taken place. So began to lobby for and establish and become the national director for an immunization program for kids in Ebola survival areas. So we're here, as Yehuda says, we're in for the long run. We're in on the front end in terms of training now, our cohort now, and our cohorts before, and we're in to support and facilitate the growth and expertise of our alumni on the ground, and they are phenomenal. Many of them are frontline, some of them are not. They're at the community making masks or making this or making that. So it's broad, but in the end, we'll still be here, as will you. And when this is over, we'll be asking the other questions. Okay, what's left? We know what has to be done now. How are you doing? What are the programs that you couldn't manage and that you know you need to? Where are you going? Because the focus for WHO was, first of all, universal health coverage, which has kind of gone by the by, but health systems for sure, interest in health systems, how they're working, what you do in under-resourced situations, vulnerable populations, all of that. Thank you.
Thank you very much, Yehuda and Maureen. And I want to reiterate, I think you've got the message, everyone that's on this call, that the academia is no longer a tower of ivory. We want the connectivity, bringing in the solutions, the tools of science to help you, and you can open doors for the scientific arena to understand and learn more. So that's also one relationship which we would like to enhance, actually as part of this joint mission of trying to facilitate the response. We're getting to the very close to the completion of this webinar.
Can I make a comment?
Yeah, just 1 second, Tzvi, with your permission. Because we're nearing the end, and I would like to leave the time for the closing remarks also of Alon. I would like to ask anyone, and Tzvi, you will be the one, if you would like to make any last comment or insight that you would like to share. And remember, what we did here is only the preliminary step. This is not the last step. We're going to continue. This is only the beginning. And I think we all saw that there's a lot of readiness and willingness to share, and there is a vast ability to actually facilitate the work of each other. Please.
Yeah, so I just wanted to reinforce the message of the research. I think this is a very special opportunity for research, and that we will try. I think everybody that is involved in the developing countries should encourage the people, the local people there, to accumulate data or various questions that can be answered following the epidemic, which would be extremely important both for the science, but also for the future application.
Thank you very much, Tzvi. Is there anyone else who would like to share insights, recommendations, comments? This is the opportunity to do so.
I would like to share a comment. And of course, it comes from my experience. Armed conflict and war will not stop because of the pandemic. And the consequences of it will be catastrophic for the populations in those contexts. And that we want to remind in all the languages possible, because during these days that everybody's suffering so much, people that are already suffering because of conflict and violence will continue to do so, and even more. And also, the epidemic and the virus has no distinction of the population or borders. The borders for the virus are simply artificial. So now we recognize that we're more connected than ever, and precisely in urban settings with highly dense populations, the impact of the conflict of the virus will be exponential, and even more for communities without access to water, to electricity, to basic health services. So uniting all forces from every angle of the world, from the academia, from the private sector, from the humanitarian sector, it's absolutely necessary. And then allowing the space for those at the front lines to work with the communities will be fundamental. Thank you.
I want to add something, Bruria.
Certainly, and thank you very much, Maria. Go ahead, Benjamin.
Thank you. I want to address some things that we have in these countries that, as I mentioned before, we have a lot of lacks and a lot of challenges, no? And I want to share with you my feeling with I am used to make a humanitarian response 15 years ago. I've been with Yotam in Nepal. We are used to move a lot of resources, human resources, material resources, money, everything to save one life. Only one life. It's enough for us, because this is our DNA, no? But now we are facing scenarios, very, very, dramatical scenarios that we know that a lot of people will suffer, a lot of people will die, and actually that's the time when we, the humanitarians, have to think out of the box, how to deal with our experience and to connect with this reality. We are facing a black swan, like Nicolas Taleb write in the book. So we have we will have lack of beds. We will have lack of supplies. We have already lack of culture of cooperating people in these countries. We have a lack to follow orders. The people doesn't know how to follow orders. Everybody, like you mentioned before, is involved in this crisis. No, everybody is involved. So we have the future that we are imagining, and in certain things that we are just imagine for the future. So we have to make a continuity plan. Okay, so actually our response it's in several arenas, and I want to share with you that because it's important. We are just launching an app, and a technological app with an Israeli company that we will contact thousands of people in home to give them psychosocial support and mental health support to reduce, the violence and the stress and the everything that we can do, and a medical support also from a remote, to reduce the people that are going to the hospitals, but also at the same time to support that people in home. And actually also we are giving also a spiritual treat to these people. We have an ecumenical team, very beautiful ecumenical team that from all over the religions that they are giving also the support. Actually, one of the things with the Cadena specific point of view is that we are working with the Jewish communities around the world. So we are taking part of the Jewish community, let's say, emergency plan. So we have both arenas open, and this is a very challenging thing. And just to finish that, we want to share with you and to cooperate with you in whenever we want, whenever we can, because I think that this is the only way that we can face this scenario that for us is a very challenging thing to work and to to use all our resources. The money is an issue because the companies that usually support us, they all already give us their own situation and their own crisis. They are dealing with his own crisis, no? So it's a challenging thing. So this is the moment to work together and to put every effort that we have a success and a good practices to share and to replicate all over the world. And thank you to be part of this webinar. It's an honor.
Thank you very much, Benjamin. And I would like to say a few closing words before I give the mic back to Alon. First of all, I want to say, as the famous words of Churchill that said many years ago, it's not the end. It's not even the beginning of the end. At the most, it's probably the end of the beginning. And what I mean by that, I mean that this has shown us the wealth of insights, knowledge, competencies that all of you have, and together that makes us all much stronger. So I would like to say three main points. One, that were raised during this webinar, and that we actually should take them forward from this point on. The first is, and this was stressed by many of you, that what we all want to do is enhance the capacity building of the local communities, and each of one are contributing towards that. And this takes me to the second point, if we are wise in sharing the insights, each one from their own field, from their own sector of work and so on, and bringing this into the humanitarian space together, all of us can work that much better and achieve a much more effective response. Which brings me to the third and the last point, is that we're also, all of us are involved in this and engaged. And if we want to be successful, I think this support system, which we've started, and I would like to thank Sid for bringing this humanitarian space to all of us to make us that much more easier to understand each other, to not start to learn and invent the wheel each time from beginning, but actually take it from the experience of others and then facilitating our work much more effectively. So having said that, I want to thank Sid for all that you're doing and for giving me and us the opportunity to actually work together and achieve a much better and more effective response. I want to thank the panelists, all 8 of you, and I'll just, with your permission, state again, it was Dorit and Avital, Tzvi and Yuda, Maria, Rafael, Benjamin, Maureen. Thank you, each one of you. And thank you, all the attendees. We all have very busy schedules. We all have in these times so many webinars, and I think our ears are already getting the shape of the earphones and so on. But you took the time to be with us. Thank you very much. Alon?
Yes, so very briefly, again, to say thank you and to say that this is really the beginning. This is the beginning, and as SID is not an operative organization, our goal is to create a dialogue and to share information, not only between the Israeli organizations and their partners on the ground, but also with the Jewish organizations who are active in different places in the world. And we believe that by sharing the information and raising it from the field, it may lead later on for different opportunities for cooperation. And it is also important to remember that after the chaotic stage, we will need to address the second stage, and there will be a lot of work. And from our point of view, although in these tragic circumstances, this is still a great opportunity to create cooperation between players who are coming from different sectors. So thank you all, and keep tuned. There are a few interesting webinars that we are planning in the near future, and you are all invited.
Thank you.
Thank you. Good night. Have a great night. Thank you very much. Bye-bye.
Thanks, everybody.